So, in the series of A to Z, we are now at T. And for T, I'd like to discuss trigger points and also touch a little bit upon something similar, tender points. Have you ever heard about tender points? So, trigger point, what is really a trigger point? Well, let's use the description or definition that the Mayo Clinic has published. And I will read from a paper. Sensitive areas of tight muscle fibers can form in your muscles after injuries or overuse. These sensitive areas are called trigger points. A trigger point in a muscle can cause strain and pain throughout the muscle. When this pain persists and worsens, doctors call it myofascial pain syndrome, and that's a description of a trigger point. But there's really no agreement on how they form and develop, or what the best treatment is. Research, again, is limited or not very good. It seems they can form suddenly in conjunction with an injury, or they can develop gradually over time. I think the most common way for them to form is gradually over time, as I have many clients as a massage therapist, which I am, who get these who are not very physically active or obviously not injured. Treatment can be done in many ways. You can work with dry needling, wet needling, even injections, but maybe the most common form of trigger point treatment is digital ischemic pressure, which is a very fancy way of saying that you're pressing down on the trigger points with your fingers, so kind of massage. I also use connective tissue massage, which also I think is equally beneficial, an equally good treatment for trigger points. It works. They tend to go away or at least decrease. Sometimes multiple treatments are needed, but they have a tendency to come back. So what is a tender point then? It sounds very similar. A trigger point, a painful area in the muscle or connective tissue which hurts when you press down on it, and it can hurt anyway, of course, without any pressure. It sounds very similar to a tender point, but there's a difference. So a tender point, and again I would like to read, tender points are areas of tenderness occurring in muscle tendon junction, bursa or fat pad. So not just in muscle tissue, right? And where can we find this? Well, quite commonly though, if they occur in a widespread manner, they seem to be a sign of fibromyalgia, or rather a characteristic of fibromyalgia. So tender points are not really the same as trigger points, but they're quite similar, and they can occur in other forms of tissue than trigger points usually do. Treating tender points is a bit different than treating trigger points. You can insert a steroid or treat it with a numbing agent, and dry needling has also been shown to work in some cases. So that's trigger points and tender points for you. A bit more complex or a little bit more unknown areas than maybe I would have thought, or you would have thought perhaps. But I hope this short video helps a little bit in your understanding of this phenomenon. If you like this channel, if you like this kind of content, please consider subscribing, liking, and sharing. I would appreciate that a lot. Thanks, and bye.